Hi everyone, this is Dr. Praveen here. Today I am going to discuss commonly appearing nail problem like ingrown nail, that is onychocryptosis, and the paronychia, that is inflammation adjacent to the nail. So paronychia, any inflammation in the nachial fold on the either side. Para means adjacent, onychia means the nail. So any inflammation adjacent to here and this part is called as paronychial inflammation or paronychia. So this whitish part is called as lanula, and the part which is behind this part is called as eponychium, and beneath the nail is called as hyponychium. So totally paronychia means in the fold if we are getting an infection, that is called as paronychia. Here inflammation involves the folds of the tissue surrounding the nail. What are the causes for that? See, wearing of the shoes that crowd your nail, toenail. So wearing the tight shoes and all. And most important is cutting of the nail too short. If you are cutting the nail very short and all, then what happens? It starts growing, the margin of the nail starts growing into the fold of the nail, inside the fold of the nail, that is called as ingrown nail. Inside the nail has grown inside, that is called as ingrown nail. The another important is and trimming of the nail not straight across, should trim the nail in the straight fashion. I will take the diagram representation of the nail trimming here. This is a common mistake I can say. Usually the nails are trimmed in the curvilinear fashion. So if you wanted to avoid the ingrown of the nail, then what has to do? So it has to trimmed in the straight fashion, linear fashion. So it should be straight across. And if you wanted to avoid injury, means infection, paronychial infection and all, then we have to avoid the injury. And unusually curved nails, that is a pincer nail. So they are folded inside, the nails got folded inside. So those are called as pincer nails, are the cause for that. So how to assess whether we have cut it straight across or got a curved and all? So if you touch like this, maximum surface of the nail should come in contact with the ground surface. So with minimal rotation, both the margins should touch the grounding. So there is an we can say the effective method of assessing it. So what to do if it is so? If it is an ingrown nail, what are the things we supposed to do? See, you can use a dental floss wire. You can put a dental floss the ingrown nail and move the floss and you can cut it. Another way is ZX procedure, that is the avulsion of the nail bed only. So put a tourniquet here, block it with the local anesthesia, and you have to separate the eponychium, and the infection already got spread inside the nail, then this entire nail has to be removed off. So anyhow we are leaving the germinal layer, so once again the regrowth is commonly seen. And another common cause for the paronychial infection is keeping the area wet or moist. If your working atmosphere is like that, then we have to avoid such conditions. And this should not be trimmed, nail should not be trimmed in the V fashion. So it should be straight across. This is the right method. This is the wrong method of trimming in the curvilinear fashion, and trimming only the margin in the V shape, that is also a wrong method. So this will causes nail will start growing inside the paronychial fold, and that may leads into formation of the abscess there. So if it is so, then we have to put an incision like this and drain it. So here I am introducing two instruments to trim the nail properly. See, if you are using such kind of instrument, so the surface itself is curvilinear. So when you are trimming it, it's the most commonly we make a mistake of trimming the things in the curvilinear fashion. And another important instrument, this is a nail trimmer, so which has very sharp end, and it's the most useful instrument I can say. Even we can get a two springs here, so which will retract the handle, so it will just act as a spring. Okay, so this is a very helpful instrument to trim the nail in a straight fashion. Okay, if you wanted to buy this instrument, the link will be given in the description box. And the infection which are there surrounding the nail, which are also called as in ancient medical science, is also called as chippa, or else akshata, or else upanaka. Naka mamsadishtaya पीतम वातश्च वेदनाम करोति दाहपाकौ च थम व्याधि चिप्पमदिशेत तदेव अक्षता रोगाख्य तथो उपनक मित्यपि. The one which is causing a hyperemic appearance, that is called as and paka, and causing the burning sensation, that is daha. Such kind in the surrounding the nail, such kind of condition is called as chippa. And another two names for this, akshata and upanakha. If it is a ingrown nail causing the inflammation, ingrown nail is called as onychocryptosis, which needs only the proper trimming of the nail. And if the ingrown nail causes the paronychial inflammation or infection, then it is called as paronychia or chippa or akshata or upanaka. Chippa मुष्णमाम्बुः सिक्त मुत्कृत्य sravayat bishak. So if it is so, you have to take an incision and do the sravana. You have to remove the pus, collected pus. So this is the treatment. And if it is, and even Agni Karma also told, you have to do the cauterization for the unhealthy granulation. So this is about the commonly appearing nail problem, that is onychocryptosis and paronychial infection, and this is how we can prevent such kind of things by taking the care of our nail. If you still have any doubts, comment box, so I'll try to answer for that. Thanks for watching the video.